The meeting is being live streamed. This will go in just a minute. The meeting is being live streamed. Oh, okay. This will go in just a minute.
What is that?
I think we're good. Yeah, don't know. Okay. Oh, I don't know why. Okay, on just a minute. Let's mute this one.
Do you think we have two going on?
No, for some reason, but I think we're good now. It's just, we're good now. Okay. Hi, Dr. Roland. I am so honored to have you and just receive your time. I'll just kind of start those of you, and I'll introduce who Dr. Roland is. Those of you tuning in, hello, and you may know me, you may not. My name is Danielle Carr. I'm a registered and licensed dietitian.
Everybody knows you.
Thank you. Thank you. My love, my passion is definitely gut health, but working on prevention before, or I should say prevention versus intervention, because it is so crucial, and especially in today's day of what we have going on with this wonderful pandemic, or as Dr. Roland just called it, the dampemic, which, wait, is that what you called it?
Yeah, that's it.
Yeah, I love that. I love that. And so I have helped multiple thousands of clients help with how do we work on prevention versus the intervention, and what supplements do we need to be on to stay healthy. Let's get healthy before it's too late, whether we're talking about this pandemic or not. It's so important. And we have 70 to 80% of our immunity that is in our gut. So important of what we feed our body to help with immunity, which is fighting off viruses and flus and RSV and cold and whatever else is going around, not to mention feeling good and helping with any other comorbidities. So Dr. Roland is the owner of Evolution Medicine Dallas. He also is working on has a virtual platform program that he will be talking about, where he can help patients with COVID, or whether it's post-COVID or any other type of patient that needs help. I'll let him explain that a little bit more, but it is a true honor to be in his company and have him talk about what he's seeing, as he's also a doctor in the ER and works with COVID patients, I'm sure thousands and thousands by now. And so thank you for being here and being with me today.
Absolutely, and it's such a delight to join you. We've had the honor before, and you're such a gracious host and such a knowledgeable person. It's wonderful to work with you. Thank you.
Thank you. Well, thank you. Okay, so let's start, because I know, along with your incredible business, Evolution Medicine Dallas, where you have multiple people with gut health, you work tireless hours in the ER and seeing patients. What are you seeing now? And I'll let you kind of take that from there, what you want to get out to the world.
Well, I will say we've had some significant success with the vaccine, and I continue to see mostly the people that are getting sick are those that haven't been vaccinated. I will tell you that I went to work the other day, and the doctor coming off had been vaccinated, didn't feel well, had 101 fever, and sure enough, we tested him and he was positive. So we call those breakthroughs. Those are people that have been vaccinated and still get the disease. I haven't yet seen anyone being vaccinated and having to be hospitalized, nor have I seen them die of it. I know it does happen, and there have been some teachers, I think, in Florida that had been vaccinated and died with it. So it does happen, but it seems to happen a lot less. So, that would suggest that I'm really kind of in favor of the vaccine. And, I guess overall I am, but I think there's some very valid concerns about the virus, the vaccine. This vaccination type, this type of vaccine is unprecedented, where we use RNA and DNA and print out these proteins and then have the body react to these proteins. There are some alarming things. These spike proteins are popping up in other locations, worrisome locations like the brain. And they continue to be there for a lot longer than we anticipated in a number of people. So the immunologists are concerned about the potential for developing further autoimmune conditions. And, I haven't seen a whole lot. Because of the smart people around that I hear from time to time, I think there's some valid concerns. So yes, I'm vaccinated, and most of my colleagues are vaccinated, but not all, and I respect that. I think there's more to learn about this. I also recognize that because of this cohort of people that aren't going to get vaccinated or can't get vaccinated, they may not be in the right age group, they may have immune conditions that really don't allow them to get vaccinated. Lots of reasons why they might not get vaccinated, valid reasons other than just not wanting it. Mm-hmm. I think that this pandemic is going to continue. And so, we're going to have to, as doctors and society, have to learn how to deal with it. So I really made a pivot in my practice. I am treating COVID patients, and we're developing pathways by which we provide more support. I think one of the early things that I was just devastated about in the emergency room is we would send patients home and just no support at all. Mm-hmm. And that's awful. So I can imagine how isolated that those patients must have felt. The support is getting there. Most doctors are now doing virtual visits, and we're ramping up so that we can provide them medications and get them shipped to them within 24 to 48 hours and really actively treat. We're working on ways of getting nebulizers into the home so they can treat their respiratory conditions. We're working on ways of getting oxygen home to their home so that they, have a little bit more support. And that's what we're doing. So, and I've had the luxury of working now with a couple of other doctors. We've linked together. It's called Retire the Pandemic. Dr. Tom Yarima, who's in California, and Dr. Bill Cole, who's in Florida. And together we're providing quite a bit of care to lots and lots of patients and supporting them. Yeah.
And is it you're providing care even if it's, let's say someone goes to the ER with, I guess they would not be going to the ER with completely mild symptoms, but right, at least symptoms to where you feel like they're getting through COVID? Do you send them, is it also supplementation regimen that you give, or? Yeah.
Yes.
Okay.
So, and this is where we get, perhaps a little controversial. We are a fan of Ivermectin. There are studies out there showing its support, and there's a group of doctors, the frontline COVID critical care doctors, who've amassed the data about ivermectin and other interventions. And so we use that. I just got an article yesterday sent to me that said that ivermectin wasn't of help. So we review it all and we look at it. I think that ivermectin helps. In vitro, within 48 hours of taking ivermectin, the viral replication of virus is shut down over 90%. And so early on, if we can get ivermectin on board early, it seems to be of more benefit than later. So we've learned some lessons. We actually, as curious as it sounds, early during the disease, we want an aggressive immune response. So we will tell people, for instance, not to treat fever unless it's over 102. because we want that febrile response. We want to stimulate the immune system so that we get a robust resolution to that infection. And it is the lack of the resolution that is driving this continued inflammatory storm that tends to dominate the picture during the second half of the disease. And that typically happens during the second week. So we have the fever and the aches and pains and whatnot during the first week. And other than ivermectin and vitamin C and vitamin D and whatnot, we stay out of the way of the immune system. And then during the second half, we'll actually intervene with things like prednisone to reduce and to suppress the immune system, because now it's overinflamed and we're trying to calm it. So we've learned a lot. There's some caveats along the way that have helped us.
Yeah, welcome to science. Now, would you say, have you seen a big difference between patients that have come to you now with the Delta variant versus, because I feel that I know the Delta variant is just like a whole nother animal.
Yeah.
You know, some doctors will say, don't even think of it as COVID. It's a completely different virus. Have you still seen success with ivermectin in your patients that have the Delta variant?
So far, I haven't really seen, the reports tell me that, comparing side by side, that this Delta variant makes people sicker. I can't say that I've really witnessed that.
Okay.
The side-by-side comparison suggests that this illness lasts a little longer. I really can't say that I've noticed that either. But that's out there.
Yeah. Okay.
Mm-hmm. I certainly have seen long COVID syndrome, where people continue to have problems after having the virus. And weird things too, things that I've never seen before, things that nobody has seen before. And, it's kind of curious. One of my patients has this very odd presentation of swelling in the sinuses area. And she kept complaining about it, and nobody could identify anything. He looked in her nose and there was no signs of any swelling, but she had this intense pressure. And then finally, she started developing swelling of the forehead and swelling of the neck. And what is unique about this is there's certainly lots of things that cause swelling of the skin. It wasn't of the skin. And there's certainly lots of conditions that cause swelling of the mucous membranes, like the lips and the tongue and the structures in the mouth. And it wasn't that either. It was in between. It's kind of in the fat area, the subcutaneous fat. Very odd. The closest I can render it, and after going through a pretty extensive search in a rheumatology textbook, is a mixed connective tissue disorder. And I just, I compare my notes with all of my colleagues whenever we get together, and they have unique stories too that they share with me that nobody has seen before. So, this we were taught. I was taught in functional medicine school. I'm boarded in family practice. I think you know that, but I also went back to get boarded in functional medicine. And we're taught that because of exposures to insecticides and pesticides and not eating well and all of that, that autoimmune conditions, we're going to see more and more of them, and we're going to see more and more variety, things that we've never seen before. And that clearly is true. It's accelerated with COVID.
Oh, yeah. Yeah, I've heard multiple little crazy stories about long COVID, whether it's somebody having trouble breathing, they feel like they have early onset Alzheimer's or early onset dementia, or just still the brain fog that lasts 6 months or more.
That's right.
Are you seeing a difference at all? And I know you see a multiple amount of patients, but do you see a difference among the healthy that come in, or maybe the ones that look healthy versus the unhealthy, or the ones that have maybe more comorbidities, obesity, or maybe even just being overweight or not?
I am, I certainly, those that come in with a history of smoking, those with asthma, those with diabetes and hypertension and obesity, all of those have a higher risk. COPD, all of those have a much higher risk of having complications. But I also continue to be surprised by people that do extraordinarily well.
Yeah.
I followed a patient, a family. He's 72 and she's 68, and he had bad COPD, and they all got COVID. And they also take care of an intubated adult that has ALS or something like that. And trying so hard to keep him from getting the illness. And despite them having the illness, neither one of them got real sick, even though up in age and had COPD. And the adult child didn't get it.
Wow.
And I'm just amazed. How in the world, all three caregivers, the nurse and the two parents, all get COVID and he doesn't get it? Just amazing.
Yeah, it just picks and chooses.
It does. Oh, and I do want to mention one thing about the spread of this. Ventilation helps. Dose of the virus appears to be one of the biggest things determining whether or not you get sick. So if you're masked and you're wearing a shield or something, and you go into a location where there is virus and you get out right away, you're probably not going to get sick.
Nice.
If you're highly ventilated, sitting outside appears to be pretty safe. We haven't seen, picnics where lots of people have gotten ill. That flow of that air seems to really help. And we've actually extended it to those that actually have COVID. Now follow this. If you have COVID, you're at the beginning of your illness, you're starting to spew out these viruses. It appears to help if we put a fan on them and we blow that virus away from the patient, because there is this concept that we auto-inoculate ourselves. So we've got it, you start spewing it, and then even the breathing of those viruses can infect other areas of the body, other areas of the lung.
Okay.
It seems to make a difference.
Well, so then that makes me think, if somebody does have COVID, obviously they should not be going out anyway, right? But some people do. I would assume that wearing a mask would be worse for them.
Haven't read that.
As far as, because you're breathing in that air again, right?
Yeah.
So don't go out if you have COVID.
Don't go out. Don't go out. No, but sitting on your porch and getting some sunlight and getting ventilated with the natural air is a good idea.
Yeah. On the flip side, that's right. That might help people actually stay home.
And by the way, some moderate exercise may be of help too. We want to exercise those lungs. We want to get that stuff inside the lungs. We want to kind of get them out. Most of them have a pretty dry cough and whatnot, but we want them breathing deeply and exercising their lungs. If you've got a partner that has it too, then give each other pats on the back and across the chest to massage and to try to get that mucus out of there and keep those lungs as inflated as possible. It's called pulmonary toilet, but we encourage that. Yes.
Okay, wonderful. So I don't know if you've heard this. I've also heard, that's really interesting. Sleeping on your belly will help if you do have that, right? With the help to get the oxygen out of the lungs.
Yeah. One of the patients, it wasn't on my shift, one of the patients that we had, of course, we try not to intubate, right? If at all possible, we don't want to intubate. We don't want to take up a ventilator if we don't need to. We ended up transferring a patient. Every time we laid the patient back, they would start desaturating. But if we laid them on their stomach with the head kind of hanging off the edge of the bed, his oxygen saturation is maintained. We learned that quite a while ago with even intubated patients. We'll prone them, we'll put them on their stomach while they're intubated to try to help the lungs. So anyway, we were able to transfer this patient safely with oxygen levels maintaining and a good level over 94 by placing him on the stomach and transferring him to the other hospital on his stomach.
Nice. So it sounds like if you do have COVID, some things to do would be definitely to sleep on your stomach, but during the day to keep breathing, maybe have a fan on you, sit outside, get some vitamin D, meaning sit outside with the sun, exercise a little bit, mild to moderate activity would help. Anything, and possibly ivermectin. We'll talk about your virtual platform of helping as well. Anything in particular you would see patients be on when they get COVID or before that you would want them on for supplementation?
So we've talked about vitamin D before, and I will tell you that I put lots and lots of people on vitamin D. And I don't know about you, but I never have people coming back to me and say, oh boy, I feel so much better on vitamin D.
Right.
It never happens.
Right.
But the research shows us that vitamin D is very, very important to the immune system. Low vitamin D levels are associated with MS, which also is not an immune condition, right? Low vitamin D levels appear to be associated with autism and with learning difficulties. And we know that this virus attacks the brain too. That's why we don't have, sense of smell. It attacks those nerve endings. Everybody with COVID, if you do an MRI, will show damage to their brain, to the frontal lobes. That appears to be a long time thing to heal. So vitamin D is important, and I'll typically give 5 to 10,000 units to get their levels to the 50s, 60s range.
Yeah, absolutely.
Then the next most important is vitamin C. But before we leave vitamin D, you're right, going outside and getting natural vitamin D, activating that vitamin D, the D3, you want D3, but activating it naturally with sunlight's even better than taking it orally. And doing both is probably better than either one by itself, right?
Sure, yeah.
Vitamin C is important. Zinc is important. We learned the relationship with zinc with dealing with herpes. We know that herpes, if we're taking zinc, the herpes outbreak lasts less, and it does also with this too. So it helps with this. And then there are a list of other things. Turmeric, coumarin also help. Am I saying that correctly?
Are you turmeric?
Turmeric, yes, cumin.
And curcumin.
Curcumin, that's right. And melatonin has also been of a benefit. So yes, we favor all of those things.
Sure. Good. I have some I would add to that, but I want to stay with you. So what you're seeing helping people post-COVID, maybe with COVID, post-vaccine, how are you helping people with this new virtual platform? I'm excited about this for you.
Well, we are able to, we're working out the kinks to be able to get them supplements, to get them medications, to instruct them about these interventions, and, kind of teaching them how to care for themselves while they're there. And yes, getting an oximeter where they're following their oxygen levels is important. And they can see, if they're sedentary and they lay back, they don't ventilate as well. So if they're up and they're giving pulmonary toilet, they're, percussing their chest and getting rid of that mucus, they can see their oxygen levels improve. If they get up and walk around and exercise, they can see how it affects their oxygen levels. So yeah, we don't want people sedentary. They'll get worse just laying in bed. So despite that, we want them getting up, showering, and getting active. And we provide support too. You know, just a little encouragement along the way and say, hey, we've seen people like you get better. Just stay in there, hang in there. We also are able to intervene and say, hey, your oxygen level is to the point now that you do need to go to the hospital.
Mm-hmm.
And tragically, we have seen patients that have then gone to the hospital, and maybe several hospitals, and won't get admitted because they don't have room.
Mm-hmm.
And they're told, well, you could stay here in the emergency room and in this cot in the hallway, or you can try it at home and you can come back later when you're worse. We are seeing that.
Wow.
Tragically, I think that we're losing some of the sensitivity about ERs getting full. And my colleagues and I are preparing to deal with patients that we can't get moved.
Mm-hmm.
So we think about that and prepare for it. It hasn't gotten that bad yet, but certainly all ERs everywhere are full.
Yeah, yeah. I'm sorry that you and your colleagues are having to see that. And you're so right. The insensitivity that's starting to happen around that, just because places are so full. And is that what made you pivot and take this pivot on to help people virtually, because maybe they're being sent home from the hospital, or they can't get to the hospital?
Yes. And I also, frankly, am coming to the conclusion that this is just not going to go away.
Mm.
I don't think the vaccine approach is going to solve this problem.
Mm-hmm.
I think about 4 different variants that we have circling the globe right now, and you realize that this vaccine operates on an exponential pathway, not a linear pathway.
Mm-hmm.
I certainly hope that we get, herd immunity and this all goes away. But if we continue on the same path, we may not have 4 variants next year. We may have 16.
Mm-hmm.
And each successive variant is less responsive to the current vaccines that we have. So, well, then how do we manage that? So with flu, we have a quadrivalent vaccine that we try to anticipate the 4 that are going to cause problems that next year. Sometimes we're successful, sometimes we're not, about anticipating that. Is that what we're going to do with this? I don't know. I have a feeling that this is going to require a shift, a shift in approach.
Mm-hmm.
And my personal one is that I'm going to focus on treatment. And to that end, I have joined with 2 other doctors who also are focusing on this. And we've created a platform called Retire the Pandemic. Dr. Tom Yarima and Dr. Bill Cole out of Florida. Dr. Tom is known as Dr. Tom, and he's listed, and you can find him on YouTube and various places as Dr. Tom. So we're developing that portal to be able to provide support for people, even remotely. I am moving to my practice from Rockwall to Mesquite, and we do plan on being able to test with drive-up people to test.
Nice.
We do plan on being able to apply vaccines to those that are interested. And I do plan on having a back door to the office so that we can treat some active COVID patients keeping them safe and away from other patients.
That's fantastic.
Mhm.
So if somebody is needing your assistance and wants to get help, how would they contact you?
Retirethepandemic.com is
Okay.
one of the places. And then my local place is evolutionmedicinedallas.com. evolutionmedicinedallas.com.
Great. I'll put that below in the show notes.
Great.
One of the things I love about you, Dr. Roland, is you're so calm. You explain things to your patients. You're incredibly intelligent, as you could hear just now. But I'll tell you, when my husband, myself, and our 3-year-old baby had COVID, as you know, I had so much anxiety, so much stress. We had also given it to my 67-year-old parents. Thankfully, they are in incredible health, that we were all okay. But I can tell you, my anxiety and my stress was through the roof one night. And I really believe if I didn't have help from a doctor that I didn't know, it was a friend of it was our friend who knows a pretty doctor, we'll just say a doctor that works with mainly only COVID patients, especially in the ICU. Anyway, he had helped me on the phone, just calm me down and talk to me about the stress and the anxiety and how that will only exacerbate COVID more. And so I just wanted to say that, because something you had said about that, going through your practice virtually and how you'll help people just calm the stress and the anxiety. I cannot tell you enough how much that helped me. And anybody that can come to you, I wish I had called you at that point. I was just kind of crazy, and we had a friend over delivering us food outside the door. And so he called this doctor and had us talk on the phone. But I highly, highly recommend anybody listening, if they need help with post-COVID, going through COVID, to come talk to you, because again, the way you explain things, the way you are just so calm, and you can help people through whatever it is they need help with, but especially through this pandemic. You are a blessing to so many people.
Thank you very much. That's very kind of you.
Yeah, it was kind of a long-winded story that I didn't plan on telling, but I had to.
I'm so glad you did. And I had forgotten that it ripped through your family as well.
Yes,
wow.
It
When
did.
was that?
We got it. Say again?
When was that you had it?
November, somewhere around November 6th.
Wow.
Yeah, so we are all good now, but I am such a firm believer in getting healthy. Unfortunately, there's not a lot of education out there about the controversial subjects that you are talking about with ivermectin, but also just prevention and supplementation and getting healthy. And so if anybody watching, if you are wanting us to talk a little bit more on something in particular of prevention or intervention, we would love to know. Write it in the comments, and I would love to do this again and have you on, Dr. Roland, if you would like.
Great, sure.
We could talk for hours, but I know we try to keep this short. As any of you know that watch our channel, we try to keep it as short as possible, so you will stay tuned and get at least enough information for you to retain it. So thank you again, Dr. John Roland, for your time. Please reach out to him, and we appreciate you guys. Thank you.
Absolutely wonderful. Thank you.
Yeah, no problem. Thank you. I'll talk to you soon.
Bye-bye.
All right.